Because many agents in chemotherapy, not all but many, are associated with some nausea, at least, patients are always given some medication prior to starting the treatment to try and combat that nausea. It's always better to prevent something than climb on top of it once it's occurred. So our aim always in relation to this is to try and make sure that you never feel nauseated, because it's much easier to prevent the nausea than it is to try and fix it once it's turned up. So all patients will get some kind of treatment for nausea control for any chemotherapy pretty much. And many other drugs are also associated with different kinds of pre-meds for often some steroids and that sort of thing, but you don't need that, so nope. We won't give you anything you don't need. Okay, so I'm connecting the drug to the line that's connected to Katina. We, as a safety procedure, usually active drugs, or the drugs themselves, aren't connected directly to the line that goes straight into the patient, so it's not straight into Katina. It's normally put on what's called an add line or a side line, and what that means is that we can have a non-active fluid that is a flush that we can use in case we need to flush the line and do those sorts of things. These drugs, although again this particular kind of drug, these targeted drugs, don't have the same toxicity profile even for people like me, the operators who deal with the drugs all the time, we still tend to treat them like other chemotherapies, and so there's safety procedures that we have in place to do that. So we would never pull this spike out of the bag because that would expose everyone around here to exposure to the drug, and we don't really need that. If we don't have to have it, we won't do it. So now I just set the pump to give the drug over the required time. Right, so now the drug will come down the line, go into that needle, which I've put into Katina's port, what's called a port, and that goes into a nice big vein in her chest. So the drug goes straight into the bloodstream.